The role of interprofessional collaboration in nursing education. I'm Jennifer Dunn, here presenting from Roberts Wesleyan. So what is interdisciplinary collaboration? Interdisciplinary collaboration can be defined as when multiple health workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care. It's been deemed an essential competency for nursing. In the instance of healthcare systems, the interprofessional team includes nurses, physicians, care management, social work, multiple therapists, and many more. Interprofessional collaboration encompasses effective communication through verbal, electronic, and written forms. The interdisciplinary team is working towards a safe discharge plan for each and every patient. Care would not be unified or reliable if teammates are not on the same page as one another. In education, we must prepare our students for a team approach in healthcare. Interprofessional education is where we have students from multiple disciplines learn from one another. For an example, nursing students learning together with speech-language pathology students can work for safe swallowing practices in an acute stroke patient. Why is this significant to nursing education? Nursing educators should enforce and support interprofessional collaboration throughout the educational experience. Students who are trained in an interprofessional manner are more likely to form collaborative practice patterns after they graduate. Learning beyond expected outcomes is achieved through interprofessional discussion and encounters. Collaboration can encourage learners to explore and learn about other viewpoints, which is why their learning is ultimately increased. The collaboration between disciplines has been deemed necessary for effective and efficient healthcare delivery. As we all know, our healthcare is changing. The population is aging, and there's an increase in chronic conditions. In fact, more than half of the world has a chronic condition affecting their health. With chronic conditions, there's a need for education and preventative care through self-management of symptoms of their chronic diseases. As a nurse educator, there is a need for us to empower our students to impact these concerns. The geriatric population is one that has diverse and unique needs that needs to be accounted for when planning care. The entire healthcare team must be on the same page for their benefit. Chronic diseases are a burden on our patients. Many people who suffer from chronic diseases have low health literacy levels and require special tailored education for success. Reinforcement and repetition have been shown to increase learning. So if the entire healthcare team is saying the same plan and suggesting the same things, patients are more likely to understand and follow through with the suggestions. Using patient education as a tool in preventative care is another way that nurses can impact the future of our healthcare. Collaboration in action. The evidence-based practice change that I'm proposing is an implementation of patient-centered education focused on the self-management for COPD patients, a chronic condition that affects many, many Americans. To be successful, there must be support in all hospital disciplines, such as respiratory therapy, pulmonology, internal medicine, care management, and nursing. The patient is another essential partner in the success for this education plan. Nursing is the primary educator in this plan, but information fact sheets from pulmonology and respiratory therapy is going to be provided to the patient. Respiratory therapy also helps us determine and initiate home oxygen plans for if the patient is needing oxygen. Care management also ensures medications are affordable and obtainable. They're going to give our patients supplies that they need and lists of community supports. The biggest burden falls on nurses, where we're going to take all the information from all the disciplines and give the information to the patient in their discharge instructions, along with the discharge instructions from their attending physician, which is going to include follow-up appointments, and we are going to utilize patient-centered education methods such as the teach back, method, or ask, tell, ask, to ensure understanding. By working together, all of these disciplines will ensure patient success by decreasing readmissions to the hospital and increasing self-management skills. Nurses are leaders. We spend the most time with our patients of all the disciplines in the hospital setting. It is for this reason that we are the ones that make the largest impact and have to ensure the patients are receiving the best possible care. For the implementation plan, nurses are going to be delivering the education and ensuring that the patient understands their role in the success. The project leader, who is also a nurse, is going to be the guiding force for the project success to ensure that staff nurses are educated on the plan and provides incentives when the plan is completed correctly, and they're going to be a conflict resolution resource. Throughout the project, some collaborative strategies that will be used are going to include collaboration with pulmonology and respiratory therapy to ensure correct and accurate and up-to-date information is given to patients regarding their COPD management. Not every COPD patient is the same. These two disciplines are instrumental in providing these self-management techniques and assisting in educating nursing staff on those management techniques. Project leader is going to inspire the others to join the task force, and together, the task force and the project leader are going to inspire the direct staff to follow through with this plan to improve our patient success rate. There's going to be support from our physicians and care managers to ensure that patients are ready to be discharged to home with all of the resources necessary to be a safe discharge plan. Technology has increased the amount of communication that occurs in healthcare. Electronic medical records are astronomical and amazing to help compile a complete and concise record of all disciplines and the recommendations. We see notes from all disciplines like physical therapy, pulmonology, nurses, physicians. All of the disciplines that are involved in the care of the patient are going to be accounted for to develop a personalized discharge plan. Verbal communication happens every day. There's grand rounds, going over specific discharge barriers. Verbal communication between nurses is going to also be required for the success of this plan. Because of the time constraints that takes to educate patients, we have to rely on our neighbors, our peers, to help care for our other patients because we don't just have one. Electronic documentation of the patient education is going to be essential too to ensure that we're actually doing the right way, the right education to the right patients. By working as a well-oiled machine, interprofessional collaboration is going to ensure that patients are receiving the best possible care and that all our T's are crossed and I's are dotted. Nursing education must begin this process by educating future nurses on the importance of working as a team and allowing them the chance to practice during school. Laying a good foundation of the team approach to healthcare during school increases the likelihood that nurses expect a team approach in acute care. Interprofessional care is patient-centered and has improved outcomes. Oops. Overall, to deliver the best possible and patient-centered care and education, nurses and the entire healthcare team should have the same goals. Proper and frequent communication is going to ultimately ensure the safety of our patients. Here are some references. They were very interesting to read. I suggest if you're interested in this presentation, click on those links. Thank you so much.